and this month I'm joined by Dr. Erin Terada, who is a licensed clinical psychologist, and she is the program director for the Eating Disorders program at Linden Behavioral Health Hospital. She's also a certified eating disorder specialist, so I really wanted to have her here to help us understand a little bit more about eating disorders in general, but specifically to talk a little bit more about binge eating disorders. So, Dr. Terada, thank you for joining me today.
Thank you.
So, the Eating Disorders program at Linden Oaks, can you give us a quick overview of that? And then what is your role as is it program director, clinical director?
It's clinical director.
All right.
So the program itself actually is multi-level. We have everything from inpatient to partial IOP and aftercare services for specialization in eating disorder care.
So when we say partial or IOP, we're talking about like partial hospitalization or intensive outpatient?
Correct.
Okay.
And we are one of the only hospitals in this area that actually takes the variety from severe level to aftercare services for eating disorder care. Which is pretty specialized care in itself and needs specific interventions and treatment options. So as a clinical director and as a certified eating disorder specialist, I design the programming to make sure that it's all evidence-based and also oversee the clinical operations for the clinical therapy services that we offer in each level of those programs.
Okay. So you have a pretty full plate of things that are happening there.
Yes.
All right. So maybe just to kind of give us a good background about what we mean when we're saying eating disorders. I know people hear that and they might hear about some specific terminology or like anorexia, bulimia, that kind of thing. But give us a layman's definition of eating disorders.
The layman's definition that I usually give when I talk to people who don't understand what eating disorders is it's really a dysfunction in your relationship with food. And that may be where you fear food, or you feel you can't control yourself around food, or your relationship really is unhealthy, or helps you cope with things, but really is dysfunctional in other areas of your life. It's not necessarily about the food too, but it's really coping through having an unhealthy relationship with food. It usually ends up being something where somebody has a core issue that it's being expressed by that food, but then when you get down to the core issue, it really ends up being more about self-esteem or about obsessiveness or perfectionism or a need to be needed, wanted, loved, and food seems to fill that void.
Okay. So while somebody may really focus a lot of their energy or everything on food or not eating food kind of a thing, that's not really kind of what's troubling them at the core of everything.
Right. But you need to fix your relationship with food before you get to the core of those other things.
So treatment overall is going to help people manage more effectively their relationship with food, if I'm going to say it that way. And then as they kind of develop that part of it, then they can start to look at some of those other pieces.
Correct.
Okay. Because if they're still eating in a more disordered kind of way, it continues to sort of deflect from those core issues? Is that kind of what's happening?
It's really truly an emotional avoidance. So the more that I engage in my unhealthy relationship with food, the more that I'm avoiding dealing with that thing that really is keeping it going.
Okay. So I know they talk about, say, like anorexia or bulimia, but could you give us a good definition of what each of those are?
So really it's along a continuum.
Oh, okay.
And when you look at the continuum of eating disorders, anorexia is on that end of really being in an extreme state of medical unstable state. It's really more of that really critical period where somebody might need extreme interventions, or they have gone so far with their eating issues that they end up becoming fearful of food, as well as really not looking at the risks that it's taking on their body, or considering that it's taking a risk on their body. Somebody who's very underweight, somebody who's in a bulimia phase, or who is bulimia nervosa, is somebody who is engaging in a cycle with food. They may not be completely underweight, but they are in a place where they are having that unhealthy relationship with food. Either they feel they cannot control it, or binging on it, and then compensating for that, and really all their self-appraisal is the core thing that they're really looking at when they are, deciding whether they're binging or purging or doing the behaviors to compensate for that feeling.
Okay. So what would be some of the signs or symptoms that someone would know, either for themselves or maybe somebody that they care about, that that person might have an eating disorder?
Well, I think for each disorder it's different, but some key things that you may want to consider if you're looking at somebody and thinking that they might have a unhealthy relationship with food is really, how they're tackling food in those moments. If they're avoiding situations where food is available, or they seem to be getting very rigid around their food, if they seem to eat food and then automatically disappear, or if their weight changes, their health changes. Those are all key variables that can be seen on the outside with somebody. Really, when they are engaging in an eating disorder, a lot of it could be invisible and you may not see it, but some of the behavioral things are easy to see at first. A lot of times these are secret behaviors. They are shameful behaviors that people engage in. They don't readily want to see or be in situations where people will be seeing, those behaviors. But over time, when somebody is really struggling with an eating disorder, it is harder to keep it secret. So some of those things, such as avoiding situations with food or getting rigid, over time becomes very noticeable. When a kid or an adult is actively avoiding eating with other people, or going to restaurants, or getting very, very rigid in the amount or portion of what they're eating, the people around them are going to start suspecting, because their behaviors with food have changed over time to a point where it is becoming a disability in their life. It's becoming something that they're not able to function with anymore.
In mental health first aid, we always talk about the level of disruption. So is it disrupting, your ability to go to school or work? Is it disrupting your relationships with other people? So you're kind of saying it could be disruptive, because it's like, hey, food is such a social activity that people engage in, that you might notice it in that way.
I usually tell family and supports it's the thing that usually ends up bonding us, but ends up breaking people. And that's when the point when they see treatment.
Okay. When it starts to really impact relationships. How long, and I don't know if there's a typical answer for this, but how long do sometimes people experience the disordered eating before they present for treatment, or before they're showing up and saying, yeah, I'm struggling with this, I'm having a hard time?
A lot of times it's variable. So some people may seek out treatment immediately. We do see the average age of people presenting with it being about 12 years old.
Wow, that's the average age?
About 12.6, so 12 or 13. A lot of times, though, those symptoms start at that point. People can wait many, many years until they actually seek treatment, or hide it for a very long time until they seek treatment.
Wow.
So I've seen people at 12, I've seen people, honestly, at 60, 70, who have gone and hid it for that many years from people, and done they think, a very good job at hiding it for those years, and probably have fooled people for a while, but then end up always seeking treatment because it's starting to impact their health.
Oh, all right. Well, so this is a great foundation for understanding eating disorders, but when we come back from our break, I'd like to talk a little bit more specifically about binge eating disorder.
Sure.
So join us after the break to learn a little bit more about that.
Their support changed my life.
They were like family. My voice is now heard.
A home for every animal.
My future is bright because they cared.
This is our home now.
Thank you to the 1,200 nonprofits that serve Cass and Clay counties every day.
Welcome back to Mental Health First Aid. We've been talking with Dr. Erin Terada, who is the clinical director for the Eating Disorders Program at Linden Behavioral Health. And so let's talk about binge eating disorder, because we didn't really talk about that yet. So what is binge eating disorder?
So as I talked about before, that continuum, you have anorexia, the extreme, intense medical stabilization on one point, bulimia, there's other disorders in the middle there. We can consider binge eating on the other side of that sort of continuum.
Okay.
In terms of, there is a variety of other behaviors that go with that. It does have links to the other eating disorders. However, some of the complications, some of the behaviors that specifically go with binge and emotional eating are separate, and treatment is separate than what you would do on the other end of continuum. So binge eating actually is just using kind of the layman's term of it is that unhealthy relationship with food, but it is really under controlled. It is feeling out of control with food and engaging in binging, which would be considered eating a large amount of food in a very small period of time than what somebody who would averagely do with that food would eat. So for example, it would be having a pizza and eating it really, really quickly within probably under 15-20 minutes, or having 2 or 3 of those and eating it within 20 minutes. But a regular person would probably take 1 or 2 slices, feel full, and then go, on with their day. Binge eating person would feel out of control with food. They would feel that they could not stop themselves, physically uncomfortable to the point where they need to stop, but that is the only signal that they have to stop. And then afterwards, unlike the other disorders, they don't do anything to compensate for it.
So when you say compensate, you might be talking about making yourself throw up or
over-exercising, using some means to purge or a compensatory behavior to get rid of the calories you just took it in. Instead, it leaves them feeling a lot of sadness, numbed out, guilt, shame, anger, and then they complete the cycle again.
Okay. So I was just thinking, Erin, as you were talking about that example of eating 2 pizzas or eating in a short period of time, that someone may not be recognizing that sign of fullness, or even if they do recognize it, just continuing to eat regardless.
Unfortunately, somebody with a binge eating disorder could also have problems with those signalings in their endocrine system or biologically, not really be able to detect whether they're hungry or whether they're satiated or full, and have a really difficult time making those distinctions on how to stop or when to stop, so they get physically full too quick or too much, and to the point where they physically cannot eat anymore or have signs from their body where they get nauseated, they feel like they're going to burst. That is the only signal that they have. So until they actually see those signs in themselves, that is their signal to stop. And sometimes that doesn't stop them at all. They just keep going.
Wow. So imagining sort of the physical discomfort that must bring on for people.
Yes, extreme physical discomfort and also emotional discomfort, that they feel so out of control that they may accidentally have a episode of nausea or vomiting because they can't stop themselves, and then really feeling guilty that they can't stop themselves. And it really is emotionally taxing on many patients who have that. Okay.
So you kind of brought up the topic of sort of like emotional eating or whatever. And so, I mean, come on, we all eat to feel better. Oh, gosh, I had a bad day at work. Sometimes in my mental health first aid classes, I'll say like, what are your coping strategies for a bad day at work? And I generally get somebody saying,
a pint
chocolate,
of ice cream,
yes. Ice cream, chocolate, that kind of thing.
That is completely normal. Emotional eating and actually overeating is something that we're all capable of doing, and sadly enough, all engage in from time to time. It's not something that it's a bad thing. It's something that for the average person might happen probably 1 or 2 times a year. When we emotionally eat, we may eat at times when we're sad. However, a binge eater might eat at times when they're sad, when they're happy, when they're just feeling something, when they're stressed out, when they're not feeling something, to just be able to regulate. And the difference between somebody who is engaging in binging versus emotional eating is that this is the main coping skill that they use.
So they don't have other ways of trying to address feelings of sadness or anger,
or just even feeling. Just even feeling. So, you know, everybody, every year, you know, the best example that I have is you overeat on Thanksgiving because it's tradition. You go to your favorite restaurant, you order a steak, it's great. But then that dessert cart comes around. You know you're really full from that steak, but you want that dessert. So our bodies are capable of doing that. It doesn't mean that every single night we do that same thing. It doesn't mean every week we might do that same thing. A binge eater has a really hard time engaging in stopping in that behavior or knowing when to stop. They will just keep doing that because it is emotionally bound.
And how is that disruptive in people's lives, other than, you know, physically for themselves, but how is that disruptive maybe in relationships or, you know, work life, that kind of stuff? It
can be disruptive in work life. People will leave work and go binge, or they will be secretly binge when they have a hard time at work. It can disrupt relationships where they are soothing with food and their partner is asking them to stop, or they're seeing health signs, or finding materials from binging. It can actually impact people financially and also legally as well. You know, there's a lot of times people will end up getting to a point where they will take most of their paycheck and go on a binge, or end up in a very extreme point, possibly shoplifting or dealing with theft charges because they're binging. So it is pretty serious beyond what we think it is. And those are extreme examples, but it can really impact a person's ability to function in their circumstances.
What about health problems related to binge eating disorder? What are there some physical health problems that are attached to that?
There definitely can be. Just like all eating disorders, we have a variety of medical complications that come with each. For binge eating particularly, there could be health problems just with the overconsumption of food. So the things that you see with obesity, which is a part of some people who have binge eating disorder, but not everybody who engages in binge eating is obese. But you can get the same sort of consequences from over engaging in eating, such as diabetes, high cholesterol, heart problems, pulmonary issues, so inability to breathe, sleep issues. A lot of them have sleep apnea. A lot of them end up with non-alcoholic fatty liver. So even though they may not be engaging in drinking issues, they're still having the same problems as somebody who was drinking with a liver issue.
So treatment really has to address medical aspects of the disorder as well.
It has to highlight those. Usually when people seek out binge eating appropriate treatment, they end up actually correcting a lot of those issues, because if they stop engaging in the binge or emotional eating, those issues go away or are manageable.
Great. So we're going to take another break, and when we come back, I'd like to hear about the new binge eating disorders program at Linden Oaks. So join us after the break to hear about that.
Their support changed my life.
They were like family.
My voice is now heard.
A home for every animal.
My future is bright because they cared.
This is our home now.
Thank you to the 1,200 nonprofits that serve Cass and Clay counties every day.
Welcome back to Mental Health First Aid. We've been talking with Dr. Erin Terada from Linden Behavioral Health about binge eating disorder. So I hear that Linden Oaks is opening up a new intensive outpatient program for binge eating disorder specifically.
Yes.
So what would that program look like? Or tell us whatever you want to about that program.
So really it's exciting because we've never had binge eating services in our service line for a while. And it's the one area where we really were missing a service line to address that whole continuum. So adding this in, it does take a different approach, and it's going to be able to service the whole line of eating disorders, which is really exciting. The binge eating program is really going to look at correcting that relationship with food, but in a different way.
Okay.
It's mostly going to emphasize really having a healthy, balanced lifestyle. And that means not emphasizing weight loss as a key point in the program, even though many people might seek that out. It's also going to address really exposure to those binge foods and really addressing the behavior in general.
So you said exposure to the binge food. So what do you mean by that? Like learning to eat those foods?
And do so without binging on it or having the after effects. So somebody who may have a particular binge food, we're going to teach them how to have that in moderation and have a healthier lifestyle with that food.
So you brought up the pint of ice cream. So if I tended to binge on ice cream, it would be
We would teach you how do you have ice cream.
A bowl of ice cream.
Yeah,
Okay.
and just have that bowl
Okay.
and be okay with it.
Okay. Even if emotionally I was still feeling really uncomfortable with that. Okay. So there's sort of the healthy lifestyle food part of it. What about, are there therapy parts to the program as well?
So the therapy parts are really going to look at incorporating cognitive behavioral therapy for eating disorders. So that looks at a variety of different things that go into that unhealthy relationship and that core issue that drives it.
Okay.
So we do have to look at things like depression issues with, binge eating, also anxiety issues, as well as sometimes substance abuse that might come in along with binge eating. When they're not binging, sometimes substances are used to substitute for not binging. So we have to deal with all those different issues in the program. And that could look like really challenging some of the notions behind why am I eating what I'm eating, and when am I hungry, and why am I hungry right now, and what am I hungry for? What's driving that for me? And really getting them to look at being more intuitive eaters. Even when somebody may not have those signals for hunger or satiety, we're going to get them to really try to be more intuitive about their emotional responses around food, and hopefully be able to develop a sense of that this is an appropriate time to eat, or start to develop at least some sort of sense of, hey, I might be hungry right now, or this is appropriate time for me to eat.
Okay, all right. So it's an intensive outpatient program.
Yes.
So how many hours a day, or?
We put it for 4 hours a day, particularly at a time where we know binge eating is very high for people.
And when is that?
So it is going to be an evening IOP from 3:30 to 7.
Okay.
A lot of times people, when they come home from a stressful day of school or from work, they will engage in binge eating. We want to be able to capture people at that time, but also not disrupt their regular daily activities. If they're having a hard time functioning, we want them to be able to start in a program where it allows them not to disrupt their life, but also gets them to correct some of those functionings in their life.
And is this adults only, adolescents, adults, or what's the age range?
It's going to be
for the
18
program?
and up, males and females in the
Okay.
program.
So that brings up a couple of questions I had. So you said males and females. Is it, are there gender differences in terms of a percentage? Like, is this more typical in females than males, or?
What we know from research is that there might be more males who actually have binge eating than females. Many of them may not seek out treatment just due to eating disorders. Well, that's a female thing, it might be a stigma. However, out of all the eating disorders in the evidence base, we actually see about 5% in the population over a lifetime engage in binge eating disorders, whereas for anorexia, it's about 2%.
Okay.
And for bulimia, it's about in the middle.
Okay.
So a lot more people engage in binge and emotional eating, and a lot more kind of gender equality in binge eating than the other disorders.
Okay. And age of sort of like onset, is it, you mentioned
For
earlier
the
age.
other disorders, it's younger. We're still trying to get a lot of good information. Since the DSM-5 put it in as its own eating, disorder category, as binge eating is now. In past versions of the DSM, it was not in there separately.
Okay.
So we're really gathering a lot of data about when the prevalence starts, what age of onset. What we're seeing right now, the age of onset, could be around those times, especially if other people are engaging in binge eating in the house or other addictive behaviors. However, age of onset is really probably going to be a little bit more higher than anorexia or bulimia. So we're looking probably around 16, 17 for most. But a lot of that data is still being collected on the whole continuum of binge behaviors with both males and females.
All right, interesting. So this is an adult program in the afternoon, evenings. How many, what's the capacity for numbers in terms of the program?
Right now we're starting off with taking 8 and hopefully going to expand from there from our initial start and then grow it as we go. So right now we have the capacity for 8 patients. And then hopefully soon, next month, we'll be able to take 8 more and then expand and expand and expand.
All right. And the program, what is sort of the start date for when the program goes live?
We are officially going to start on the 23rd of January. The program runs from Tuesday through Friday from at 3:30 to 7:30.
Okay.
And it's going to be in the evening. So 23rd is a Tuesday, and we will be open and ready for business.
All right. So why not on a Monday?
Monday, because of our other programming, we actually have a Monday night format for our partial and IOP, which we do include with multifamily services and treatment. So we want to be able to use the same space at Linden Oaks Hospital on those nights where it's not being utilized for this program.
Gotcha.
And since it's an IOP, they're mostly out in their day-to-day life. It's going to be a shorter program.
Sure. So it gives people that opportunity to go live your life, deal with sort of the stressors that are going to come about on a day-to-day basis and get that support then kind of at the end of your day and figure out and learn other ways to kind of manage that stress in a healthier way.
Yes, that's very well put.
All right, great. And if somebody wants to find out more about the, any of the eating disorders programs, how would they go about doing that?
They can contact me or they can also contact our call center. And find out more information through there, make an assessment or appointment.
All right, so that would be the Assessment Referral Center at Linden Oaks, and the number for that?
Is 630-305-5027.
Okay, and if part of the assessment process then for that would be to come in for kind of an overall assessment, there's a health aspect to that assessment as well? There
is. We are going to ask people, like any of the other programs, we would ask for labs and EKG. We want people to be medically stable and appropriate to be able to come and live their lives. If they're really medically unstable, they may need to seek other treatment services before they come to us. So if they have diabetes that is not managed or other things that might impede their ability to go to work or do that, school or whatever that is, we want to be able to make sure that they're appropriate for the program.
Great. Well, thank you so much for being here today to talk about the binge eating program and help us all learn a little bit more about eating disorders. So thank you. It's been great to talk with Dr. Erin Terada about eating disorders and specifically binge eating. And until next time, be well.